brain health professional certified by the clinics where I was trained. And the first area we're going to talk about is called the prefrontal cortex. It is this part underneath this part of your skull. It's the large blue area in the cartoon brain, or the front part if you happen to be colorblind. In the SPECT scans that are shown, the one in the middle is the underside of a healthy brain. It does show two small spots there that would be indicative of an ADD, ADHD kind of issue, although these are very small and considered healthy. The bottom of the brain has a lot of ridges and areas that fit into the skull, and we'll see more about that later. The color doesn't matter. The whole is not a whole. It is an area of the brain that is not functioning properly. It's not getting enough blood flow. The picture on the far right is the top of the brain looking down. The prefrontal cortex is where the arrows are pointing, and then it's kind of purplish. That color means nothing. It's the color there is just to show the contour better. So let's see what the prefrontal cortex does when it's working well. It's the executive function in the brain. It is responsible for attention span, being able to persevere, judgment, impulse control, organization, self-monitoring and supervision, problem solving, critical thinking, being able to think ahead, like in a chess game, being able to think a few moves ahead, learning from experience, which is critical, ability to feel and express emotions, influences the limbic system, and it's also responsible for empathy. Think of the prefrontal cortex as the cop in your rearview mirror. It keeps you from doing things that you shouldn't do. I think it was Dudley Moore who said the best driving aid is a cop in your rearview mirror. So something to that effect. Anyway, the prefrontal cortex, when it's not functioning well, is responsible for short attention span, distractibility, lack of perseverance, impulse control problems, hyperactivity, chronic lateness, poor time management, disorganization, procrastination, unavailability of emotions. And that's an interesting one, and one that's worth spending a bit of time on. Unavailability of emotions. It's not that they don't want to, it's that they can't. It's responsible for misperceptions. They may take things the wrong way. Poor judgment, trouble learning from experience, short-term memory problems, social and test anxiety. With prefrontal cortex problems and the disorder, or in the extreme, the disorders that come from the prefrontal cortex, typically the harder the person tries or the child tries to concentrate, the harder it is. And so telling them to try harder is counterproductive. Telling them to relax, helping them to relax, keep breathing, affirmations and that kind of thing, even meditation, helps them to relax and helps the prefrontal cortex to be boosted up. Actually, with some people, they will actually pick fights to increase the prefrontal cortex function. They'll be like snipers trying to pick a fight with someone. And if they can get somebody else going, it gives them a boost. And it's not It's not conscious, it's not volitional, it's just something that helps them feel better, which seems very counterintuitive, but that's the way it works. So now let's talk about the deep limbic system. That's where the amygdala resides and the hippocampus. And I mention those from time to time. The arrow points to the gray area, which is the deep limbic system. In the SPECT scan in the middle, we're looking at the underside surface profile, surface scan, and you can see the arrow pointing to the deep limbic system. It doesn't show up very well. In the far right SPECT scan, that's a surface or deep activity scan. And you'll see at the bottom, that's the back of the brain, that's the cerebellum. It should be the hottest part of the brain and usually shows up as a very bright white or red sort of smiley face. And the dot in the middle there that the arrow is pointing to is someone with deep limbic system problem. So what happens when the deep limbic system is working well? It sets the emotional tone of the mind. It filters external events through internal states or emotional coloring. And that's kind of like if you're having a good day, everything seems to be okay. You know, something happens, somebody cuts you off, you don't get upset about it, and you just keep going on your way. Because who knows why they cut you off? It could have been that they're rushing your child to the hospital. You just don't know. It tags events as internally important. It stores highly charged emotional memories. It modulates motivation. It controls appetite and sleep cycles. It's the hypothalamus, which is also in there. It promotes emotional bonding. It directly processes the sense of smell, and it modulates libido. Now, if your child is 0 to 4 or 5, you're probably not real interested in knowing that. But children as young as 5 start to see differences between themselves and the opposite sex, and they can sometimes experiment, and that's normal. If there's more than a 2-year age difference between children, that's a problem. So just a note. The deep limbic system is larger in females than it is in males. It's near the pain center in the brain. So in grief, your deep limbic system misses a loved one's touch, voice, and smell. It can actually, that's why you actually feel. The limbic connectedness is the main biological reason battered women do not leave their batterer, because they feel this connection that stems from the limbic system. So what happens when the deep limbic system isn't working well? Well, you can be moody, irritable, you can have clinical depression. You can have increased negative thinking, perceive events as in a negative way, decreased motivation, a flood of negative emotions, just like when you're having a good day, everything seems good. For someone with a low or a very high overworking deep limbic system, they see everything as negative. That's the idea there with the negative filtering. Appetite and sleep problems. It can be too much appetite or too little, too much sleep or too little. Decreased or increased sexual responsiveness can result from deep limbic system problems or not working well, and social isolation is another one. So now let's move on to the basal ganglia. And remember, this stuff is all going to be repeated in the modules that talk about these things in detail. This is the material that I'm providing basically for free so that you get a chance to see what areas you would want to focus on, or if you'd like to go through the whole series. So basal ganglia, it's that little orange bag hanging off the side of that brain. It sort of hangs off the deep limbic system. It's um, it would be where the red spots are in the center SPECT scan. That's the bottom looking down. Also bottom looking down, but active view shows the basal ganglia at the end of the arrows. You'll also notice the big red area in the back, which is again cerebellum, and that is the way it should be because the cerebellum is responsible for balance and coordination and things that you use all the time. So when the basal ganglia is functioning well, it integrates feeling and movement, shifts and smooths fine motor behavior, suppresses unwanted motor behaviors, sets the body's idle and anxiety level. It enhances motivation and is responsible for pleasure and pleasure and ecstasy. It's also responsible for anxiety, but that's on the flip side. So the basal ganglia, what does it do when it's not functioning well? It allows shifting of, it is responsible for anxiety and nervousness, panic attacks, physical sensations of anxiety, shaking, as an example, feeling butterflies in your stomach, um, tendency to predict the worst, conflict avoidance, Tourette syndrome, and tics. Tics are muscle contractions that are involuntary. We might have an eye tic or a mouth tic. Tourette syndrome is actually just a combination of vocal and motor tics. And the most publicized vocal tics are profanity, and that's actually not typical. It could just be clicks, it could be um, words that someone says or noises. Um, but anyway, that's kind of the Tourette's area. It's responsible for muscle tension and soreness, for tremors, hand shaking, that's an example. Fine motor problems, not being able to do things because your hands are shaking, you're anxious, headaches, and low or excessive motivation. It can go either way. So now let's talk about the big one, only because it's got the biggest name and the hardest to remember. We'll see what we can do to make it easy for you. The anterior cingulate gyrus, or just cingulate gyrus. Anterior just means front. It is the white stripe in the middle SPECT scan. That's a deep active scan. It is also shown from the top on the far right scan, and it's the red C-shaped area in the cartoon version of the front with the girl's head. When it's functioning well, it allows shifting of attention, thought or cognitive flexibility, adaptability, helps the mind move from idea to idea, gives the ability to see options, helps you to go with the flow, and cooperation. This little girl is not OCD. She's just showing that she's got clean hands and she's adorable. When the anterior cingulate gyrus is not working so well, it looks like the two SPECT scans on the far right, and you might have a teenager who looks like that, who is worrying, holds on to hurts from the past, or grudges, gets stuck on thoughts, obsessions, gets stuck on behaviors, compulsions, oppositional behavior, argumentative, uncooperative, tendency to say no. Now, a child who's 2 is typically going to say no a lot. A child who is 5 should not be saying no a lot. Addictive behaviors like drug and alcohol abuse, eating disorders, chronic pain, um, road rage, cognitive inflexibility, obsessive compulsive disorder. Uh, there is a whole obsessive compulsive disorder spectrum disorder of spectrum disorders like eating disorders. I mentioned road rage already, gambling addiction, um, and there's a bunch, and we'll talk about those if you decide to do that module. Let's shift to the temporal lobes. And in the temporal lobes, it's the green area on the side of the brain. And in the SPECT scan, it's where the red arrows are. It's kind of a big fat area when it's working working well. You can see in the side view on the far right SPECT scan, it is working too hard. That's not a good thing. When it's functioning well, the dominant side, usually the left, is responsible for understanding and processing language, intermediate term memory, long-term memory, auditory learning, retrieval of words, complex memories, visual and auditory processing. And the non-dominant side, usually the right, recognizing facial expressions, decoding vocal intonation or tone of voice, rhythm, music, visual learning, and spiritual experience. When the temporal lobes are not working well, it can be big problems. And they're often damaged in head trauma. You can have on the dominant side, you can have aggression, internally or externally driven. And you might think someone who is suicidal or homicidal in the extreme. They can have dark, violent thoughts. They can have a sensitivity to slights and mild paranoia, thinking somebody's out to get them. They can have trouble finding words. They can have auditory processing problems, reading difficulties, emotional instability, and on the non-dominant side of the temporal lobes, usually the right, difficulty recognizing facial expressions, difficulty decoding vocal intonation, implicated in social skills struggles. So if the temporal lobes aren't working well, you're kind of set up for a lot of very difficult things. And there are, we'll see that most, I'll call them disorders for the moment, or brain issues don't happen as just one thing. They happen in pairs. And an example of one that is really bad pairing is temporal lobe depression, which is the deep limbic system being too hot and the temporal lobes not working well. So now you're depressed, you're seeing everything negative, and you're unable to recognize facial expressions and decode vocal intonation. You can be aggressive, have dark, violent thoughts. It's not a good thing. Very serious, very serious situation. So let's go to the cerebellum. Cerebellum is that pink thing at the bottom of the brain. Again, it's the part that should be the most active. In the SPECT scan on the far right, it is nice and full and it's kind of bulbous almost. It's responsible for coordination, impulse control, and organization. It's responsible for speed of thought. Think of it like the clock speed of a computer. The faster the computer, like the more gigahertz uh, it has, the faster it runs. The same is true of the cerebellum. The left hemisphere is connected to the right frontal lobes, and the left hemisphere is connected to the left frontal lobes. It's I have the dancing couple there because it's responsible for coordination. And you can't dance if you don't have coordination. Um, when the cerebellum has problems, you can have coordination of body or hand-eye coordination problems, slowed walking, slowed thinking, slowed speech, be disorganized, impulsive, and have poor conditioned learning. If we look at the SPECT scan on the far right, you see what is likely a brain traumatic brain injury. The two holes in the front aren't really holes. None of the areas are really holes. They're areas where the brain's not working properly. It's not getting good blood flow. And the two holes in the front would be indicative of ADD or ADHD. The temporal lobes are malformed. They're not nice and round. And the cerebellum, you can see, has a shelf and is not well formed, not nice and round like it should be, um, but it's kind of eaten away. And again, I use the term holes and eaten away. They're not holes or eaten away. They're just areas that aren't working right, aren't getting enough blood flow, and are causing these kinds of problems. Okay, so let's let's remember your child's brain is the most precious asset they will ever have. Invest in it. You can't make a better investment than in their brain. And I can help you understand how to do that through this course, through the assessment, and through working. Actually, that should do it for most people. If something is severe, I can write a Dear Doctor letter, and those are very successful with getting your psychiatrist or medical doctor to prescribe the appropriate medication. And if it's something like bipolar disorder or schizophrenia, it's really important to go to the AIM clinics and get a brain scan because it is the best investment you'll ever make. It's expensive at $4,300 or thereabouts, um, but it's worth every penny. It'll save you tens of thousands of dollars and years. Right? So you've experienced an introduction to the brain, what the different parts do. You've learned about uh, SPECT imaging and how it's a window into how well the brain works. And hopefully you found value in what you've seen already. You should have been able to identify areas of your child's brain that may not be working up to speed and want to zero in on a specific part of my course. And you can do that. And as an example, that would cover all 7 types of ADD and what to do about each one in particular. Um, I do the assessments for $125 flat rate, and that includes getting as many people to do the assessment on your child as you want. I will score them. And then I will make a composite and we'll have a discussion over Zoom, face to face, to talk about what your child needs as an individual. And that would include a follow-up with perhaps exercise, diet, and supplement suggestions that are targeted to your child. And I also charge $115 for the Dear Doctor letter, which has been very well received by psychiatrists as well as GPs, or family doctors, or whomever. If you need a referral to the AMI clinics, I will make that referral for you, and there's no cost for that. A pretty good overview in the free sessions, but we repeat the free session part, if you will, what the brain does when it's working too hard, not hard enough, or just right. And we then go deeper, show examples of SPECT scans as, again, examples so that you can see what the brain would look like if you did go in for a scan, and be able to use those pictures for you to understand, and in some cases for your child to understand why they shouldn't do something or should do something. And I want to say that I've enjoyed the time we've spent together already. I try to make the individual courses or mini courses short in terms of each individual piece, so that it's easy to absorb and easy to understand. So, for example, ADD is 7 types, and that I look forward to working with you, and I look forward to seeing you have a fantastic day, week, month, life, to your child's health, to your child's brain health. That's where it all starts. Thank you very much. I'm Jim Hendricks, and I'll see you soon.